Yep, there's a indication ones, which we'll get to. The complications are pretty much the same as any injection, any needle stick, right? You're gonna get swelling, bruising.
Nodules, allergic reaction.
Yep. Everyone, you're gonna hear granulomas with Sculptra. It got a really bad name when it first came out. Some people still dilute it at about 5 ml. That's how they first taught us when they first came out. I don't think that people were massaging enough. They were putting it too superficial. Just didn't know how to really inject it. So it did get a bad name. So do you guys know the difference between granuloma and nodule? So granuloma has to actually be biopsied to be called a granuloma. Nodule is over 1 centimeter big. Under that is papule. So yes, so I can keep going on that whole subject because Sculptra did get a really bad name, and I love Sculptra. I'm like, who injected it on who, and how? What was their dilution? So now we do our dilutions a little bit more. At least I do. There's some people that still do the 5. Yeah, I do about 8 to 9 sterile water with 2%, which we'll tell you about how we do that.
I think it won't hurt. Like if you dilute your Sculptra, like 8 to 9, I think you're safe. It's like more diluted. It's gonna prevent you from having granuloma. So there's no wrong and right. One thing I was going to tell you guys actually, if you look around between patients who get dermal filler, I would say at least 3 out of 7 or 8, you see all this high cheekbone and a very hollow temple. Like lately, patients are looking like an avatar. And the one area that everybody neglects is the temple. And I think temple is so critical because between the forehead, temple, and cheekbone, it has to have a very nice, smooth transition. And especially women, like a typical, that they go to, like maybe injector that they don't have experience, you can see that they have such a high cheekbone. The second they smile, you can't even see their face anymore because there's so much volume has been injected to their cheek, but the temples are screaming. So Sculptra is such a beautiful treatment to bring this volume back. And as we know, when we lose this deep fat compartment here, our lateral canvas, the brow lip, it starts drooping downward and it makes you look tired. So when you guys educate your patient that look, by doing some Sculptra in a couple sessions, I'm able to bring this part of your face upward and it's going to open your eyes. Not only that, it's going to camouflage because from hills and valley, we want to create a nice smooth transition. So if you pay attention to your patient's temple, you will see that they have, especially in late 30s or 40s, there's a major volume loss, but there's this high cheekbone. And it just looks bizarre these days that people are turning to become an avatar.
The other really cool thing is Ozempic. Do you guys know Ozempic face?
I see about that.
That's where they lose a lot of weight, and they